Have you ever gone for a routine health checkup only to be told that your cholesterol is high? For many people, that moment is frightening. The first thought is often, am I going to have a heart attack? Am I at risk of a stroke? But before you panic, let's understand what cholesterol really is, why your body actually needs it, and when it becomes dangerous. Stay with me, because one of the biggest myths about cholesterol might completely change how you look at your health. Let's start with the biggest misconception. Cholesterol is not your enemy. In fact, cholesterol is an essential substance that your body needs to survive. It's used to build healthy cell membranes, produce important hormones, support brain function, and help repair tissues. Without cholesterol, your body simply couldn't function properly. Here's something that surprises many people. Even if you stopped eating cholesterol completely or fasted for several days, your cholesterol levels wouldn't suddenly disappear. That's because your liver naturally produces cholesterol. Your body makes it because it needs it. And in just a moment, I'll explain why some people who eat almost no cholesterol still end up with dangerously high cholesterol levels. So if cholesterol is necessary, why do doctors worry when it's high? The answer lies in balance. When you get a lipid profile blood test, you're not just checking one cholesterol number. You're looking at 5 important measurements. Total cholesterol, LDL cholesterol, HDL cholesterol, VLDL cholesterol, triglycerides. Among these, HDL is known as the good cholesterol. HDL acts like a cleanup crew. It helps carry excess cholesterol away from your arteries and back to the liver, where it can be processed and removed. On the other hand, LDL cholesterol, often called the bad cholesterol, can build up inside artery walls. Over time, these deposits form plaques that narrow blood vessels and increase the risk of heart attacks and strokes. Triglycerides are another type of fat found in the blood. High triglyceride levels can increase the risk of pancreatitis and may also contribute to cardiovascular disease. But here's the important part. Not every cholesterol number carries the same level of risk. Knowing which one matters most could save your life. That's why the goal isn't to eliminate cholesterol completely. The goal is simple. Keep LDL, total cholesterol, and triglycerides under control. Raise or maintain healthy levels of HDL cholesterol. If you're finding this video helpful so far, take a second to hit the like button and send a hype. It helps us create more evidence-based health content and reach more people who can benefit from it. So what numbers should you pay attention to? While your doctor will personalize these targets based on your health, general guidelines are: total cholesterol, below 200 milligrams per deciliter; LDL cholesterol, below 100 milligrams per deciliter for most people; triglycerides, below 150 milligrams per deciliter. Higher HDL levels are generally better. Now here's another common question. I'm young, I'm vegetarian, I hardly eat fried food. Why is my cholesterol still high? The answer is that food is only part of the story. Yes, unhealthy diets can contribute to high cholesterol, but they're not the only cause. Your body's metabolism also plays a major role. Poor sleep, chronic stress, lack of physical activity, weight gain, insulin resistance, diabetes, and genetic factors can all cause your liver to produce more cholesterol than your body needs. In other words, someone who rarely eats meat can still have high cholesterol if their metabolism isn't functioning well. This is where most people make a mistake, and fixing it can often make a much bigger difference than simply avoiding eggs or butter. That's why simply avoiding eggs, butter, or meat doesn't guarantee healthy cholesterol levels. Managing cholesterol requires a complete lifestyle approach. That includes eating a balanced diet rich in vegetables, fruits, whole grains, legumes, and healthy fats, exercising regularly, getting enough quality sleep, managing stress, maintaining a healthy body weight. For many people, these lifestyle changes can significantly improve cholesterol levels. However, lifestyle changes alone are not always enough. If your LDL cholesterol is very high, or if you've already had a heart attack, stroke, diabetes, or other cardiovascular disease, your doctor may recommend medications such as statins to lower LDL cholesterol. If triglycerides are significantly elevated, medications like fibrates may also be considered. These treatments should always be taken under the guidance of a healthcare professional. Before we finish, there's one final point that almost every cholesterol patient should know, and it explains why comparing your numbers with someone else's can be misleading. Finally, remember this: not everyone has the same cholesterol target. Someone who has already had heart disease usually needs much lower LDL cholesterol than someone with no history of cardiovascular problems. That's why it's important not to self-diagnose based only on a lab report. Instead, discuss your results with your doctor, who can interpret them based on your age, medical history, diabetes status, blood pressure, and overall cardiovascular risk. The bottom line is this: cholesterol is not something to fear, it is something to understand. Focus on maintaining healthy LDL, HDL, total cholesterol, and triglyceride levels through smart nutrition, regular exercise, quality sleep, stress management, and medical treatment when necessary. With the right approach, high cholesterol can often be managed effectively, helping protect your heart and your long-term health. If you found this video helpful, subscribe for more science-backed health content. And if you know someone who's worried about their cholesterol, share this video with them. It could help them protect their heart. Thank you for watching.